from the time I can remember, I think I'd wanted to be a nurse. I don't know why, but like most little Aboriginal kids, we'd been hospitalised a few times, and I obviously thought that nurses were pretty special. Certainly the biggest change has been nursing education going into the tertiary sector. We took to the streets in Brisbane, all over the country actually, and marched in support of nursing education going into the tertiary sector. I don't think I thought of it as a prestige area. It was just something that I wanted to do and to care for and look after people. Oh yes, and that was a nurse's uniform. It was lovely. We wore a long-sleeved cotton uniform with a white apron, starched, and a very stiff belt, cuffs that were removable, and a very stiff collar and a cap with all our hair tucked in. Was not able to wear hair out or much of a fringe. Black stockings and black lace-up shoes. And it was interesting because of the hierarchical structure in nursing. It was really interesting. We had to stand up when a doctor came into the room, and a nurse senior to you could only be one group ahead of you, and you had to roll down your sleeves and put your cuffs back on. It was really interesting, but certainly over time they changed and the uniform regulations lessened. We had some very, very strict ward sisters and senior staff, and if you were disciplined, and it was significant discipline, you had late passes cancelled. We had to be in bed in our rooms by 10 o'clock and the lights off by 10:30, and the home sister used to come around and do rounds to make sure that you were in bed. And we had 2 12 o'clock passes a week and 1:30 a fortnight. And if you went out without those, when you came into the nurse's home, you had to sign back in, and the home sisters did rounds several times through the night to check that you were in fact in bed and that there was no parties going on or whatever, and we didn't, of course, because the discipline was pretty strict. We didn't go off duty until everyone was ready to go off duty. We all went off together. Unfortunately, they don't do that these days, and I find that a lot of the camaraderie in nursing and the support has been lost and is missing. And I think that's a pity. We used to have to do the bundle, we called it, where we made our own wool swabs and the swab sticks, the dressing packs, and take them over to Central Sterilising Department that was in Gloucester House at PA. And if the bundle wasn't done up properly, you'd be sent back to the ward to do it again. And in theatre, we had to clean all the instruments and wash the gloves, dry them and put them through the powder machine, and have them all ready to be autoclaved. They didn't have disposable gloves in those days, so we used to fold up the drapes for theatre and for them to be autoclaved, as well as the the gloves. We had to test the gloves for pin pricks and holes and whatever else. And but that was, and sometimes we wouldn't get off until 2 o'clock in the morning, and then be back on at 6 o'clock the next morning for work. But at least we all worked together in those days. It was good. I'd like to think that it wasn't necessary, that CATSIN wasn't necessary, and one day I hope there will be no place for an organisation like CATSIN, that Indigenous nurses won't need that extra support, that they will get the support where they are working and from their colleagues and the hierarchy. But at this time I think we do need it, and as far as supporting and mentoring each other and acting as role models. It saddens me sometimes when I think there's so much emphasis placed on sports persons as role models. There are other wonderful people out there who are really good role models, tremendous role models. We'd like to think, the CATSIN members, when we first formed, that we would be able to act as role models for those coming along behind us and those already in the system, and support system for each other, and particularly to foster good relationships with the students in a mentoring capacity. To really care for people in all stages of their life, and a good nurse would care for people when their life is at their lowest ebb, and also celebrate the joy of the newborn babe. And I go back to a wonderful nurse theorist who has since passed on, Virginia Henderson. And her definition of nursing, which I really agree with, is that we act as the eyes of the blind, the voice of those unable to speak, and the legs for those who are unable to walk. And I think to be able to care and do those things, that nurse would be pretty special in my eyes. Been interested in teaching. It was an interesting story in actual fact. When I was doing my midwifery at King George V, and I obviously explained the placenta very well, because the sister, as we called them, as we were known in those days, suggested to me that I might consider a teaching pathway. And so when the opportunity came, I went to college, the College of Nursing, and did my diploma in nursing education, and then taught at the Prince Charles Hospital. And I taught the post-basic cardiothoracic nursing course and coronary care course. But I thought, no, then I'd make application to the university. I'd done my time in the hospital-based setting for education, that I'd apply to go to the university, which I did, and was lucky enough to get a job as a lecturer. And I was there for 6 years until I retired. Was aware and knew that racism was there, but I was so focused I didn't let it interfere with what I wanted to do, and I thought, well, that they weren't going to get the better of me, and I knew it was around with patients as well as some staff, but mind you, most of the staff were really very good, but once again our refuge was in the pan room, and So I just let a lot of stuff go over my head, and it's certainly there. You're aware that it exists, and it's there, and it's just hateful. But it's even worse when nurses are racist towards their patients. That's, to me, is unforgivable. Racism still exists, there's no doubt about that. Racism and discrimination is alive and well in the healthcare setting and the tertiary system, and it's very difficult. Some people will admit that it's there. Some non-Aboriginal Torres Strait Islander people are aware that it is there. Most of them are very supportive to their students or to their colleagues, but a lot are not. But you thought, well, you're in here, you're doing something, and if you were to pull out now, how awful it would have been for my family, who'd been so excited about me getting into nursing in the first place. Today, it's still there for the students, and they have to decide how they are going to deal with it. Whether they're going to ignore it, challenge it, or whatever. And it's only for them to decide. But it certainly is there, and it's alive and well, as I said. Milestones was the fact that I finished my training and graduated, and that was a wonderful one, and then to go up and do my midwifery. And it was really interesting also that I was made a charge nurse when I was only 23, which was really good, for that to happen in a major teaching hospital I thought was pretty good. And then when I went back to that hospital later and was put in charge of cardiac units, then and I was only 26. When I got my diploma in nursing education and my degree and my master's was when I was awarded the Queensland branch of the Royal College of Nursing's Distinguished Nursing Award, because I thought to be recognised by your peers is a wonderful thing. And of course then when I was awarded the Order of Australia Medal in '86 for service to nursing education and to Aboriginal health, they were really good things to happen, and I've been very fortunate. Schools of nursing need to identify that they must change their curriculum to include that upfront standalone subject or unit on Aboriginal Torres Strait Islander history, health and culture. When I see the Aboriginal Torres Strait Islander nurses that reflect the Aboriginal Torres Strait Islander population in this country, when I see it would be wonderful that there wouldn't need to be a separate organisation for them, for the Aboriginal Torres Strait Islander nurses, when they are treated with the respect that they deserve, and also the wonderful pinnacle for me would be for our people to be treated with the dignity and respect that they deserve.